State agencies fear what a $600 million budget hole will mean to those they serve. The Oklahoma Department of Mental Health and Substance Abuse Services is already turning away thousands of people seeking treatment. Without proper funding, it's feared more personal tragedies will unfold across the state.
What happened to the Stick family in Tulsa illustrates the tragic consequences that can occur when dealing with untreated mental illness. In 2012, Veronica Stick told her husband she thought their oldest son, Matt, was sick.
My wife, like I said, was much more in tune with him than I was, and she kept telling me, I think he's suffering from depression, like I am.
Matt's father, Dr. Michael Stick, is a public school teacher and a pastor at a Baptist church. Stick says Veronica was fired from Kirk of the Hills Presbyterian Church because her battle with depression and anxiety interfered with her work there. When that happened in 2011, the family lost their health insurance. So without insurance, did that delay Matthew getting proper access soon enough?
Absolutely. I don't have any doubt about that.
In October of 2012, Matt fatally stabbed his mother in the heart at their home. Stick says his son had a psychotic break when he killed Veronica.
I know that he was mentally ill. He needs to be in the hospital, in the mental hospital, receiving treatment. That's where he needs to be, in my opinion.
Instead, Matt is in the Tulsa County Jail facing an April trial for first-degree murder. He spent 22 of his 25 months in jail in segregation in the same mental health unit that O&R toured several months ago. Matt was locked up 23 hours a day in a small cell with one window, looking out only to cells in the unit housing others dealing with psychosis. Stick says his son is now stabilized.
He's receiving excellent care from the jail psychiatrist. He's just really doing a great job taking care of him. He's on an antipsychotic and also an antidepressant, and has been ever since. And they've got it adjusted, I think, quite well, and he's doing very, 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 very well. He seems like himself.
While it is rare that someone with psychosis commits a violent act against someone else, those suffering from mental illness and substance abuse are hurting themselves. The suicide rate in Oklahoma is twice the national average.
What we know is that on any given day, we have between 700,000 and 950,000 Oklahomans who are struggling with mental illness or addiction. Last year, we were only able to reach 190,000 of them. Now, for those 190,000, we have amazing outcomes, but that's still a huge gap. Any loss in funding is going to mean more Oklahomans without services.
Terry White is the director of Oklahoma's Department of Mental Health and Substance Abuse Services. She says the department's current funding is wholly inadequate, forcing them to turn away people seeking help.
And if you're sick enough, you will get services. If you're not sick enough, because we don't have enough money to serve everyone, we have to say, I'm sorry, you don't meet our criteria, which means we turn you away to get more ill. And then, if you end up in crisis or you get sicker, then we can serve you. It's a horrible way to do health care.
Michael Brose, who's the director of the Mental Health Association of Oklahoma, believes lawmakers and taxpayers should consider this.
If I have untreated diabetes and I'm having symptoms, if I don't get treatment for it, it's going to get worse and there's going to be something bad happen. It's no different. This is an illness. This isn't a moral issue. This isn't some sort of, in Matt Stick's situation, this wasn't about him being some sort of criminal or some sort of, wasn't premeditated murder.
White says the department had to cut $20 million in services in this last year. She's requesting $140 million to be appropriately funded for the next fiscal year. White says $10 million is needed just to maintain the inadequate level of services now provided.
This year, we need $10 million to keep from cutting services, again, because of bills that are coming in next year that we have to pay. I'm very concerned. The governor, in her budget, recommended $5 million towards that. The problem is that since the governor's budget came out, the budget hole has doubled. I'm very concerned about what this means for our ability to just keep services in place for those Oklahomans we are reaching now.
While White and others in state government worry about the consequences of a $600 million shortfall, Stick is afraid for his family's future, which will be determined by 12 people.
Well, my fear, since it's going to jury trial, is that there'll be people there who don't understand mental illness. There'll be people who see him as a criminal rather than a patient or a victim. They'll see him as someone who did this maliciously when he absolutely adored his mother and she loved all three of our kids. But they had a special bond because I think of the mental illness that they both had.